Many cosmetic procedures are more accessible than ever before. Plastic surgery experts at the American Society of Plastic Surgeons, or ASPS, say surgeries and injectables are steadily becoming more common. And the rising star is Botox, which came into the market in the 80s. It's an injectable drug mainly used to prevent and diminish wrinkles, and according to the ASPS, it's the most popular minimally invasive cosmetic procedure. More than 4 million people got Botox injections in 2020, up over 400% from 2000. It's easy to find injectors online, quick enough to get during a lunch break, and any side effects tend to be minor and disappear on their own. So you can imagine the surprise of the New York and Tennessee health departments when they were recently notified of Botox patients suffering from trouble breathing, weakness, and droopy eyelids. The cases were reported by physicians who, though used to seeing these types of issues, were concerned when they discovered that Botox was behind the symptoms. The reports made their way to Dr. Roisin McElroy, an epidemic intelligence service officer at the New York City Department of Health and Mental Hygiene, who opened an investigation.
We had 3 cases, 3 distinct cases that were not actually linked to each other, but that came to our attention over a very short period of time. And the clinical scenario was quite unique, and it seems strange that suddenly we were getting almost a flurry of these things.
Botox is supposed to be an easy procedure. So how did it go so wrong for these people? After 4 reports were made in Tennessee and 3 in New York, both states launched a public health investigation into what caused this sudden reaction. Dr. Christine Thomas, a medical director and former EIS officer for the Tennessee Department of Health, says that they were able to learn the truth after speaking with the patients.
They had all had their injections done by somebody who was unlicensed to do those injections. They had the injections done in a residence. And then they were able to provide pictures of the botulinum toxin that was used. And using those pictures, our colleagues at the FDA contacted the pharmaceutical company, which is how we were able to confirm that the product was counterfeit.
The combination of an unlicensed injector and fake product created a perfect storm for the dangerous symptoms. Only licensed medical professionals like doctors, nurses, and dermatologists can get approved to inject Botox. If someone operates without a license or medical training, they could hit arteries or inject into the wrong muscle. If this happens, it often leads to side effects like difficulty breathing and muscle weakness. Some injections go so wrong that patients go into respiratory distress and failure. Additionally, there are several FDA-approved Botox products on the market already, but if the product is bought outside the US, it never has the chance to go through FDA inspection. Counterfeit alternatives, which often come from places like China and Bulgaria, are readily available online and have no quality control.
In one case, it was reported that the product had been purchased overseas by the person who was providing the injections. And that sort of definitely caught our attention. First of all, overseas just seemed like maybe it was something that hadn't moved through these appropriate regulatory channels.
Authorized injections contain a small amount of a toxin that paralyzes muscles temporarily. But since counterfeit products don't have any oversight, there's no telling how much is in each vial. There are even reports of tap water and saline solutions being injected instead of the Botox patients were promised. Because of this, nobody, not even the 7 patients nor their doctors, knows what was really in the injections.
There are a number of FDA-approved botulinum toxin or neuromodulator products on the market, and these are not interchangeable. So one product cannot be changed for another if you run out, for example, or the doses aren't equivalent and the concentrations differ. So I think that's important to consider as well, that you understand which specific product you're receiving because they aren't all created equal.
Another issue with using fake Botox is that you most likely aren't being injected by a professional. Thomas and McElroy's investigation found that the injections were done by people working without a proper license. Unfortunately, people operating without the necessary qualifications isn't rare by any means. The National Med Spa Association has estimated that as many as 90% of providers could be injecting while unlicensed, and consumers often have no idea. However, the potentially life-threatening risks aren't going to dissuade the millions of people who get Botox each year. So Thomas and McElroy say it's important to know what you're truly getting into. For instance, since only medical professionals can obtain certification, places like houses and spas are not going to be reliable.
You really want to be going to a place that has that clinical background, is a licensed place. You want to be making sure that the person doing the injections is licensed.
They're cosmetic procedures for the most part, but they're still medical procedures. And where is the most appropriate environment to receive medical procedures? Really in a clinic setting that's regulated, where there are infection prevention controls in place to protect you.
Another red flag to watch out for is cost. Real Botox costs about $10 to $15 per unit, and many treatments need 30 to 40 units. So you can understand the appeal and excitement of finding something for cheap. People who don't know much about cosmetic procedures might feel compelled to look for a discount, but that usually will point to trouble.
In one of our cases, the cost of the injections was sort of priced below wholesale cost, which was definitely a red flag. Something seems considerably less than it does if you're being charged considerably less than you are in other clinics. That should give you pause for sure. If something seems too good to be true, it probably is.
And if someone isn't sure they're going to a credible spot, Thomas and McElroy say you can always ask for proof of certification.
At the end of the day, you should understand the type of injection that you're getting and what sort of risks do you want to take? Like, is it worth it? And it's a wrinkle relaxer, and it does so by paralyzing muscle. It's a nerve toxin.
You can find more information about Dr. Christine Thomas, Dr. Roisin McElroy, and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. Our writer-producer this week is Annabelle Rivera. Our lead producer is Kristen Farah. Our production manager is Jason Dickey. I'm Greg Johnson.